Have you ever had chest pain and you found yourself wondering if it was just something mild like indigestion or something more serious like a heart attack? In this video, I will be talking about a crucial topic, heart attacks. I will explore the symptoms, risk factors, and potential complications and prevention strategies. I will never forget the case of a well-respected senior colleague of mine. He worked hard all his life, was about a year on from retirement age. On this fateful day, he was driving home after a hard day's work. He had a heart attack on the wheels, and his car crashed into a tree and he died suddenly. That was a sad time for all concerned, as you can imagine. Welcome back to Health Tips with Shalom Health. If you're new to my channel, a huge welcome to you, and please don't forget to subscribe and hit that bell. I truly appreciate your support. For my lovely subscribers, a big thank you again and again. If you like this video, please give it a comment or like, as that would help the YouTube algorithm to show it to more people. With that out of the way, let's get started. What is a heart attack? A heart attack is a medical emergency in which the supply of blood to the heart gets suddenly blocked by a blood clot. It is usually a very serious condition as it can lead to damage to the heart muscle and can threaten life. Another name for it is myocardial infarction. Pathology of a heart attack, that is how it happens. In people with coronary heart disease, the major blood vessels of the heart become blocked by a buildup of fatty deposits called plaques. The plaques are already causing narrowing of the blood vessels. When one of the plaques ruptures, it causes a blood clot to develop at the site of the rupture. The clot may then proceed to cause blockage of the blood supply to the heart, which is what is called a heart attack. Symptoms of a heart attack: chest pain. This can be in the middle of the chest, on the left or on the right side of the chest. It is described as a feeling of pressure, heaviness, squeezing, or tightness across the chest. The chest pain varies in severity from person to person. Most of the time it is severe, but it can be minor in some people and they may feel like it is a case of indigestion. Whilst some heart attacks occur suddenly, some may happen gradually. That is, present with warning signs for a period of hours, days, or weeks in advance. An early warning sign may be a chest pain or feeling of pressure that keeps on happening and doesn't go away with rest. There may be pain in other parts of the body, usually because of radiation from the chest, but sometimes can happen without chest pain. The areas involved may be the left arm, but can be both arms, neck, jaw, back pain, or abdominal pain. Other symptoms are shortness of breath, cold sweats, dizziness or lightheadedness, nausea or vomiting, fatigue, feeling anxious, coughing or wheezing, indigestion. Please note that some people do not have any chest pain, and this is called silent heart attack. They may just feel short of breath, they vomit, or feel nauseous, get back pain or jaw pain. What to do in an emergency? It is very important to call the number of your emergency services if you have any of the symptoms mentioned earlier. The earlier you act, the better the chances. It may help to chew on or swallow a 300 milligram tablet of aspirin whilst waiting for an ambulance. That is, if you're not allergic to aspirin or taking any other contraindicated medications. Do not delay calling 999 or your local emergency services number to take aspirin. You must call the ambulance services first. Hospital treatment depends on the type of heart attack, that is, whether muscle damage has occurred or not, and how serious it is. Sometimes the first symptom of a heart attack is sudden cardiac arrest, where the person stops breathing and there may be no pulse. Cardiopulmonary resuscitation would need to be started before the ambulance arrives. If you do not know how to do this, the emergency services will usually give you directions over the phone on how to do it. It is a good idea to learn this if you do not know how, as it may save a life one day. Causes of a heart attack: coronary heart disease, that is disease of the heart arteries. Hypoxia, which is lack of oxygen supply to the heart from poor lung function. Spasm of the arteries in the heart. Infections, for example, viral infections. Spontaneous coronary artery dissection, that is tear inside one of the arteries of the heart. Risk factors for heart attacks. There are some risk factors you can't control, like age and family history. Men over 45 and women over 55 are at higher risk, though it can occur at even younger ages. If you have a close family member who had a heart attack at an early age, your risk is higher. Other risk factors are within your control. Smoking is a major risk factor. It damages the lining of your arteries and reduces oxygen in your blood. High blood pressure puts extra strain on your heart and arteries. High cholesterol can lead to buildup of plaques in your arteries. Being overweight or obese increases your risk of other conditions that strain your heart. Physical inactivity is another risk factor. Regular exercise helps keep your heart strong. Diabetes significantly increases your risk of heart disease. Eating lots of salt, sugar, processed foods, high fat diet can increase your risk. Excessive alcohol consumption can raise your blood pressure and contribute to obesity. Chronic emotional stress can also increase your risk of heart attack. Complications of a heart attack. The most immediate and severe complication is death. Heart attacks can also lead to arrhythmias, which are irregular heartbeats. Symptoms of arrhythmias may include dizziness, chest pain, breathlessness, tiredness, palpitations. Some people develop heart failure, where the heart can't pump blood effectively. A heart attack can damage heart valves, leading to problems with blood flow. Some people experience cardiogenic shock, where the heart can't pump enough blood to meet the body's needs. Blood clots can form in the damaged heart muscle, potentially leading to stroke if they break loose. In some cases, a rupture can occur in a heart wall weakened by a heart attack. Depression and anxiety are common complications after a heart attack. Now let's move on to prevention strategies. The good news is that many heart attacks can be prevented with lifestyle changes. One of the most important steps is maintaining a healthy diet. This means eating plenty of fruits, vegetables, whole grains, and lean proteins. Regular exercise is another crucial factor in preventing heart attacks. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week. Quitting smoking is perhaps one of the best things you can do for your heart health. If you don't smoke, don't start. If you do smoke, consider quitting. Managing stress is also important. Try techniques like deep breathing or meditation. Regular checkups with your doctor can help catch potential issues early. This includes monitoring your blood pressure, cholesterol levels, and blood sugar. If you have conditions like high blood pressure or diabetes, managing them properly is crucial. Points to note: it's crucial to act fast if you suspect a heart attack. Call emergency services immediately if you or someone around you shows symptoms. Every minute counts when it comes to heart attacks. The faster you get treatment, the better your chances of survival and recovery. Don't try to tough it out or wait to see if symptoms go away. For those who suffer from angina and are taking GTN, glyceryl trinitrate spray, don't let a positive response, that is, getting relief of the chest pain after taking the GTN, stop you from calling the emergency services. Some people get heart attacks more than once in their lifetime. It is important for them to take preventive measures to reduce risk factors. It is essential to be compliant with the medications prescribed after the heart attack and do regular checks with your doctor. In the UK, people between 40 to 74 years without any pre-existing medical conditions can have health checks every 5 years to screen for chronic diseases like heart disease, diabetes, chronic kidney disease, etc. More frequent checks will be needed if any risk factors are found. It is a good idea to have regular checks for blood pressure, cholesterol levels, etc., especially if there is a history of heart disease in your family. You don't have to wait until you're 40 or until you start having symptoms to get this done. There is no harm in getting 6 to 12 monthly general checks or even more frequently as needed. Please discuss with your doctor in your areas of abode. It's always better to be safe than sorry when it comes to your heart health. There are other videos on this channel that deal with how to live a healthy lifestyle using the 9 pillars of health and how to reduce cancer risk in general, as well as other health topics that you may find useful. Please watch them for more information. Disclaimer: the information on this channel is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. All content on or available through this channel is for general information only. No professional relationship is formed between any member of Shalom Health and yourself because of getting information from this channel. You're encouraged to confirm any information obtained from and through this channel with other sources and review all information regarding any medical condition or treatment with your physician. If you have found any value in this video, please give it a like or comment on it to give us your thoughts on the ideas discussed. And please share with the people in your life who might benefit from this knowledge. Make sure to subscribe to our channel for more eye-opening content like this. Stay curious and stay informed until next time.